I am Dr. Ram Narayan, consultant functional neurosurgeon. I will be talking to you today about the very common condition called Parkinson's disease. What is Parkinson's disease? Actually, Parkinson's disease is classified as a movement disorder. That is, movement disorder means it affects the movements that we have. So, whatever we do, there is a movement. For example, I am talking now. That is a movement because there is a lot of my muscles in the mouth and the neck and all moving. Even the muscles of the abdomen are moving for me to talk. Suppose I am walking, that's a movement because my leg muscles have to work, then only I can walk. So like that, lot of things we do is all related to movements. And whenever the movements are affected, it is called a movement disorder. The Parkinson's disease is the commonest movement disorder. And this is called Parkinson's disease because this was described by a person called Sir James Parkinson about 150 years back. In fact, in his memory only we celebrate April 11th as a World Parkinson's Disease Day. This is happening in the next few weeks. Another 11 days we have the World Parkinson's Disease Day. So, what are the cardinal features of Parkinson's disease? There are basically 3 or 4 features which is seen commonly. Of course, there are some other features also, but I will talk about the common things. One of the commonest features is what's called a tremor. That's a pill rolling type of tremor. That is, the hands will be like this. That is as if you are rolling a pill, or I joke by saying that you are counting money. So you are a rich man. So you are always counting money. The second thing is what is called rigidity. That is, the muscles of the body become very stiff, so that even ordinary movements become very stressful. The third is what is called bradykinesia or slowness. That is, your activities become very slow. So suppose you have to walk from your bedroom to the toilet, it takes about 20 seconds earlier. Now it will take about 2 minutes, 3 minutes. It's interesting in that there's another this thing called micrographia, where many people come to find out that they have got Parkinson's disease because their handwriting changes. And many of them have difficulty in getting their checks cashed because their signature is different from what is originally in the bank record. So the bank people will tell you, no, this is not your signature. So this is how some people find out very early Parkinson's disease. So these are the common features with Parkinson's disease. So what causes Parkinson's disease? So for all these movements, you require a chemical called dopamine in the brain, which is very essential, which is which helps in the movements. I am not going into the technical details of it. Just like insulin, in Parkinson's disease, just like in diabetes in insulin, in Parkinson's disease, the dopamine levels in the brain starts dropping. That is why the movements are affected. Obviously, when you know the reason, it's very easy to treat. You just replace this dopamine. So initially, the treatment of Parkinson's disease is with medications, especially dopamines. There are various forms of dopamine and various drugs which support the dopamine, so we can give all those drugs. Most of the patients, or practically all of the patients, do very well with medications for the first few years. In fact, some of the patients do exceedingly well. But unfortunately, in a majority of these patients, either the drugs start losing their efficacy, that is the time for which the drug acts starts coming down, or the drugs cause side effects. Side effects most commonly include dyskinesias, like there's a patient he cannot sit like this, he will keep keeping movements, that is drug-induced movements, the dyskinesias. Then the patients get hallucinations, so many side effects happen. So it is at this stage that we offer surgery. The surgery, as I mentioned earlier, is called deep brain stimulation. That is, you stimulate an area of the brain called the subthalamic nucleus, which is about 17.5 centimeters from the surface of the head. You put 2 electrodes into that subthalamic nucleus, one on the right and one on the left side, and you connect it to a battery, which is everything is under the skin, nothing is seen outside, and it will help you to control the symptoms. There are various, the electrodes have got 4 contact points, and the battery has got lot of parameters like pulse width, frequency, things like that. So for each patient, by trial and error, we will know which patient has got the best parameters. So one patient may require the first and the 4th electrode, another may require the first and the 2nd electrode, like that, based on the symptoms. And again, one patient may require high pulse width, one patient may require high frequency, like that. So by trial and error, we will find that which is the best combination for the patient, and we can control the symptoms. And the patient is given a mouse like what we use in our homes for our computers, and the patient can increase or decrease the current to a specific margin, and he also can put on and put off the machine when he doesn't want. So this is the treatment in a nutshell for Parkinson's disease. The surgery for Parkinson's disease usually is very effective, and patients are selected by using strict criteria. That is why the results are usually very good.